Now, as we wait for any news out of the FDA on authorizing Pfizer's COVID pill and its booster shots, cases continue to spike in different parts of the country. Nebraska is seeing its worst spike since last January. Infections have risen for 3 straight weeks, and hospitals are starting to run out of space in their ICUs, something we've heard before. With the holidays right around the corner, health officials say the situation could get worse in the coming weeks. NBC News correspondent Cal Perry joins us live from outside the Nebraska Medical Center in Omaha. Cal, good morning. So, I think we keep on hearing maybe we're nearing the end, things are getting better, but tell us what you're seeing there in Nebraska, and also what do we know about why it's happening? Is it vaccination rates? Is it the weather? Tell us what we know.
It's a combination, I think, of both of those things. The Nebraska vaccination rate is just below the national average. That certainly is a concern here amongst medical and health officials. The other issue is, as you said, the weather, right? People are headed back inside. We're headed for the holidays again. Those indoor restaurants are starting to fill up. It is all the more depressing when you think we were here a year ago, right? And the difference between now and a year ago is now we have these vaccines. So when you speak to officials here at the Nebraska Medical Center, they're just begging people to get that vaccine because those ICUs are starting to fill up. 90% capacity in the intensive care unit. So it's no longer really a pandemic for the unvaccinated, right? If you end up in the hospital due to a heart attack or some other sort of injury, it's more difficult to be treated right now. Those hospitals here in Nebraska are filling up, and you then sort of factor in the rural areas of the state. So many folks ending up here taking up those desperately needed beds, Savannah.
Absolutely. And now, Cal, we know healthcare workers across the country have also been dealing with this pandemic for over a year and a half, right on the front lines. How are they doing? How difficult is it for doctors and nurses where you are right now to continue treating COVID patients?
Yeah, it's incredibly difficult. It's also, I think, emotionally draining. The country is so divided. Some of these healthcare workers, and I spoke to one yesterday who actually is receiving basically online abuse because she's giving interviews where she's asking for folks to be vaccinated. So that is happening as well. We sort of know that it's becoming a more and more difficult job. And then hanging over all of this, right, you have this debate or this misinformation about vaccines. I actually spoke to a chaplain yesterday who's been working inside this hospital for 5 years. He's there as people pass away from the virus, and he was telling me that one of the things he's dealing with is a lack of compassion for folks who don't have the vaccine. People are angry, especially in parts of Nebraska where they can't receive medical care because the beds are filling up. It's a growing concern, and it is all the more stressful for this healthcare staff that is overtaxed, overworked, and has been at this now, Savannah, as you sort of said, for 2 years.
Absolutely. And Cal, what do these doctors tell you about the potential impact that booster shots and that pill could have for them? What kind of tool can that be?
It's a huge, forgive the pun, boost for them. Most of the healthcare workers that I've spoken to, both here, I was just in Cincinnati, I'm headed to Minneapolis tomorrow, but most of the healthcare workers I'm speaking to have already gotten the booster. They really want folks who are coming into the hospital to get the booster. And I was speaking to a healthcare official who was working with patients. She has a specialty joint service where she deals with patients who have infections in their joints. And she was saying that one of the things that she's finding that's benefiting people the most is even if they're coming in for something else, getting them to get that booster is huge. It's huge in areas like this where we're seeing now a spike in cases, Savannah.
All right, Cal Perry, some incredible reporting there on the impact this is having on those healthcare workers a year and a half into this. Thank you so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.